Hi everyone, my name is Karen and I write for More Than Borderline, which is a blog about BPD on HealthyPlace.com. So today I want to talk about some misconceptions with recovery and how clinging to the BPD label has held me back in some ways. I started learning about BPD when I first was diagnosed, which was very addicting. I wanted so badly to get better that I thought the more I learned, the more I would recover. I wanted to essentially heal faster. The funny thing is I didn't start to experience what healing really felt like because I didn't know how to be compassionate towards myself, and I didn't really learn those skills in dialectical behavior therapy. I learned that, that my symptoms had a name for them and how to do different things versus the maladaptive coping that I was used to. That's what I learned in DBT. And I felt like something was missing after I completed that program. So I called up a trauma therapist that I found online, and she specialized in BPD and complex PTSD, which is a new flavor of a therapy that I never knew I would even be interested in. When I started seeing her, I realized that I didn't really know how to be in tune with myself. I used shame a lot of the time to shield me from sadness and feeling like just that loss of, like, when you are trauma triggered, you kind of experience this grief that is hard to put into words. And to deal with that, I would just kind of feel bad on purpose just so that I could gain some sense of control or imagine some sense of control when it came to coping with the mood swings that I would have because of BPD. But like I was saying, in trauma therapy, I learned that there are different ways to look at yourself. Like, I don't have to look at myself as somebody that has BPD, but more like have compassion for me as a person. And the only way at this point in time that I know how to do that is by imagining that I am my inner child or the inner teenager or whatever younger version of myself needs the care and love at the time that I didn't get it at the time. So I have these wounds from those moments. I imagine that I'm taking care of her, and this is not something that I would have been open to in the past if I hadn't gone to DBT, because DBT really primed me to understand the disorder, but the trauma therapy is what helped me deep dive into it. And so I'm just bringing this up because I had this misconception that DBT was the holy grail for curing my BPD just because of how popular it is, and a lot of people, talk about it online. I had this idea that I would get cured when that's really not the case. And I don't even think trauma-based therapy is the holy grail either. I just now understand that recovery is a marathon. It's not a sprint, and that I'm probably not going to be in remission until, I continue on this marathon. And it's not so much about cramming the knowledge into my head, but like actually processing what I'm feeling, which is harder to do, but in the end, it feels better than trying to work my way out of my my trauma, because it's not really a problem that you can solve. It's something you need to process. And that is what I want to share today. So if you have any comments, you can check out the blog, More Than Borderline, look for my articles under Karen May Vister, and leave some comments there or comment down below. But thank you guys for watching. Bye.